making sure that our video is going to work. We didn't have Nigel ahead of time. I didn't book him ahead of time to help us. So we're going to see if we can get this as a video that the Shasta Health and Human Services put together of some examples of successful work in our community on finding housing. We're going to see if it's going to work. While they're doing that, I think I'll get things started. I appreciate everybody coming here tonight, and we'll start some introductions and then begin our presentation. You know, I really am. I guess I should start by introducing myself. Hi, my name is Kristen Schrader, and I'm proud to be born and raised in Reading. I currently sit as city council member for the city of Reading, and I have been working for the last 12 months with many people in our community who have some of the same ideas and some of the same concerns to address homelessness. And so we're trying to gather data, information, which is what we're going to hear tonight, and then we're going to talk a little bit about some of the solutions and what our next steps are. So when we started this 12 months ago, a lot of people were asking, well, how many homeless do we have? And we really didn't know. I don't think we knew adequately enough to be able, as a public policy decision maker, to be able to say, well, do we need 100,000? Do we need 1 million? Do we need, how much money? What kind of programs do we need? How many types of programs do we need? So one of the efforts that you'll see today that we've culminated into a data study. You have in your hands a summary of it. There we go. Then the full report is posted on the United Way website, United Way of Northern California, and the address is on the back page of the handout that you have here. So you can download it. We also put on the United Way website the point in time count, which is, you're going to hear a little bit about in this information, is the 1 day a year in January that the federal government is asking everybody to count their homeless. And the reason you do it in January is the federal government's thinking is, well, we want 1 day consistent throughout the entire country so we can measure it year over year to see what the differences are. And their calculation was that in most cases, that people would be in a temporary shelter in January. And so then we would count them. But then we count them every other year when they're unsheltered. So obviously if you're in Florida, probably there's a lot of different variables. So.
Susan did it. Literally, Susan did it.
I did it.
I did it. That's okay. So some of the information that you recently saw in the record searchlight was dealt with the point in time count, and that's an important snapshot of our homeless population. What we really need to do is look at a report like you were going to talk about today, that really looks at a year-round count. How many homeless do we have every day, every month, all year long? What are their characteristics? How many youth do we have that are homeless? And so doing a 1 day, 24-hour count doesn't really give you all the information that you need. It's a requirement to maintain your funding eligibility for HUD housing programs, but it's just a snapshot. It's just a little point in time. So this is what you're going to hear today. I'm going to introduce Donnell Ewert is from Shasta County Health and Human Services. Agency Director. Melissa Jenna-Levitz is with Regional Services, Health and Human Services. And Matt Rivas is with Good News Rescue Mission. Chief Paletti doesn't need an introduction. And Dr. Tyson Adams I met when he found out we're doing this project, and he's also doing research on homelessness in our community, and he's a resident at Mercy, and he will be going to work for Shasta Community Health Center. So I'm going to turn this over to Donnell, and then we'll have presentations here, and then at the end, we'll have questions and answers. And it's being filmed by channel 181 on Charter, and then it'll be posted to YouTube site, so we'll give all that information out to you after it's all done in the next day or so. So thanks again for coming. We really appreciate it. This is an important dialogue for our communities, because there are people who are the most vulnerable in our community that we need to make concerted effort to find what the solutions are and put them in place and work collaboratively in our community to make it happen. So, Donnell.
Thank you, Kristen. I just want to thank Kristen for putting this together tonight, and I also want to thank all of our partners in the community. We have a lot of organizations in our community that are working on services to folks who are homeless or at risk of homelessness, and we really can't solve this problem unless we work together. So I'm really proud to be part of a community that's got so many people, so many organizations that are interested in this issue. So thanks for coming out tonight. You know, in respect to the report, you know, I think the estimate of roughly 3,000 people each year experiencing homelessness is a reasonable estimate based on the various data sources that the team used. You know, that, of course, is according to that definition, not necessarily all unsheltered, but, you know, some unsheltered, some, you know, couch surfing, other people living in shelters and other transitional housing, but basically people in unstable situations. And a lot of people move through that too. They're not all chronically homeless. I think there's an estimate in the point in time survey of about 200 out of 750 roughly that were chronically homeless. And we have a lot of people in the community that are homeless for the first time and who have been homeless less than a year. So there's a lot of different scenarios, and each person has a different story. As far as the cost estimate goes, my guess is it's probably low, you know, on the impact of homelessness on our community. It's really hard to capture all the costs, but it's a substantial sum. $34 million is a substantial sum. And I think, you know, the public policy questions that we have to ask is, number one, you know, what do we need to do to assure that everyone has a safe place to stay? You know, I think that's a reasonable question we need to ask. And I think the other question we need to ask is, how can we organize that in a way that it costs our community the least amount of money? And that's, you know, a taxpayer question. What's the best way to invest our tax money so that we can take care of people? Do we want to always be spending it helping people on the back end try to get housed, or are there things we could be doing to prevent homelessness, or things we could be doing to reduce the amount of time people are homeless and that sort of thing? So, you know, I think that's what this whole discussion is about. Is there a better way, a less expensive way to work on this problem? I think it's also important to mention that this isn't a problem that's unique to us. You know, this problem is happening all over California. It's happening all over the country. Our country has suffered an economic crisis in the last 10 years, and we're still feeling some of the repercussions from that. So we're not unique in that situation. I just wanted to mention a couple of things that my agency is working on. I'm only going to talk about some of them because Melissa is going to talk about a few as well. So I just want to talk sort of about the behavioral health-oriented solutions we're working on. Melissa's going to talk about some other ones. But you know, a lot of people who are homeless have a mental illness or substance use disorder. I think the point in time survey had about 50% of the people who were counted saying they had some kind of mental health issue, and maybe at least a third had a substance use problem, or maybe even higher than that. So it's a significant problem. And so, you know, we do a lot in my agency to address that, and I think a lot of people don't know what those things are, so I'm just going to mention a few. When people, you know, are mentally ill and they're greatly disabled, which means they can't take care of themselves, they can't provide food, shelter, clothing for themselves, we can go to court, we can get a conservatorship for them, and we can start making legal medical decisions for them, financial decisions, and they oftentimes end up in a locked facility, which the county pays for. And they may stay there for an extended period of time, 6 months to a year, and then we try to move them out of there into a community setting. And that oftentimes is a board and care facility, so we also pay for part of that. Oftentimes they have some income that will pay for part of it, but we pay what's called a patch, which is an additional sum, so that it pencils out. And after that, we hope they move into independent or permanent supportive housing. And we have a couple of projects we're working on right now related to that with our Mental Health Services Act housing money. One is the Woodlands, which is a project in partnership with MDCSS, Palm Communities in the city of Reading. And that is under construction right now behind the RAPA facility on Highway 273. If you want to drive over, take a look at it, you'll see it's under construction. And that's going to have 55 housing units, 19 of which are dedicated to people with severe mental illness or families with children with severe emotional disturbance. So that's a big effort, and it's over a $2 million investment from the county and a total of about $17 million project. And then our second MHSA housing project, we just started working up in the Intermountain area to try to create a 4 to 8 unit facility up there for permanent supportive housing for the mentally ill population that lives in the Intermountain area. So we're working right now a lot on that permanent supportive housing side, but I forgot to mention in that board and care category, we had lost several, I think 3 board and care facilities in our community that closed in the last 10 years. We only have one that was left. And we actually use several facilities in Tehama County. And so we really felt like we needed to work on that. So we were able to attract a private party, private business who created a new board and care facility in the city of Shasta Lake called Ridgeview. So we have a contract with them, and we place a lot of people there to come out of those locked facilities. So I just wanted to mention all that so that you know that the county does invest significant resources in housing people with mental illness, and we have a whole system for trying to care for those who are greatly disabled. Now, you might say, well, I oftentimes see people who seem mentally ill who are homeless, and there are limitations, and the law only allows us to conserve people who are greatly disabled. You can actually be mentally ill and not be greatly disabled, and you're still allowed to make your own decisions, and you're allowed to make the decision to be homeless. That's not against the law. So we are limited in the number of people we can help. So those are a few things going on housing-wise in the behavioral health area. I also just wanted to mention one other thing that's going on right now, which is a big initiative of the state of California related to Medi-Cal called Whole Person Care Pilot. And the feds are granting California $300 million a year for 5 years, so $1.5 billion to work on a different model for working with people who are mentally ill, homeless, substance use disorders, who use the emergency rooms excessively. And the idea is to try to do a different approach to serve them so that we save money on the hospital side by making other investments on the front end to keep people well, keep them getting services in other places in the healthcare system that are more appropriate. So we're working on a proposal that's due July 1st for that. We're working with a lot of community partners in the healthcare arena, our drug Medi-Cal providers, and other community partners, the Good News Rescue Mission and others. So that, hopefully we'll be able to put together a proposal that's going to address some gaps we have in substance use disorder services, in our housing case management services, and some of the mental health services. So we're going to try to put that package together using some match from the county as well as the city of Reading, and be able to draw down a bunch of that federal money that we'll be able to use in the problem. So that's another, of course we have to apply and we have to get funded, so that's not a sure thing, but we are working on a proposal related to that, and we're able to work in some of the issues related to homelessness. So those are a few things that are going on in our agency and on the behavioral health side.
All right. Well, good evening. I'm Melissa Janilevich, the Regional Services Director with Shasta County Health and Human Services. My responsibilities include our public benefit programs, CalWorks, CalFresh, Medi-Cal, General Assistance. So those are some of the programs that I'm responsible for. And I also deal with a lot of young families in some of our other programs, WIC, perinatal drug treatment, some of those other programs, Nurse Family Partnership, where we deal with a lot of young families. I'm really interested in this homeless issue for a couple of reasons. Yes, I am a bleeding heart liberal and I'm a public health nurse, so I'm not going to hide that. There is a lot of compassion in why I'm interested in this issue. But from the other aspect, a lot of our young families need jobs, and they need better jobs. And we have a lot of young families that are using public assistance right now. 13,000 families right now are on our CalFresh program, used to be food stamps, because they're needing that to supplement their income. We have 2,400 families right now on our CalWorks program that are getting cash assistance monthly to supplement their income. So this homeless issue within our community is also part of economic development and our economic vitality. If we can come together and solve this as a community, we can be a better place for business to come as well, and more jobs will come here. So that's also part of the reason that this is important to me as well, to bring more jobs for young families. So the data that I looked at, first I just want to say this report that summarizes the costs is really important for our community, and the first of its kind, and so thank you, Kristen, and thanks for everyone that put the effort together. I spent my energy looking at the young family part of it, the family issues. Shasta County differs some from national data in the number of families that we have that are homeless. Nationally, and actually we're a little bit better than national data. Nationally, about 35% of all individuals that are homeless are from families with children. In Shasta County, if you read the report, there were about 10% of the individuals in this report were children under the age of 18. So this report doesn't compare directly, but when we look back over time, that number in Shasta County has been improving and has ranged anywhere from 25% down to 9%. So we've never reached that 35% since 2011. So our numbers of families that are in homelessness situations are lower than national average. So that's a good thing. On the other side of the coin, many more of our families that are homeless are living unsheltered. There's very few families with children that live unsheltered at the national level. And in this report that was just released, almost half of the children under 18 were living unsheltered. So that's much higher than national rates. So that's maybe where we're not doing as well with the data in Shasta County. So an area maybe that we can work on. I also wanted to just comment briefly on the costs. I think there's a lot of costs that have been accumulated, done a great job, but I do think that some of the costs for families are not listed in here. The costs for children, when children are homeless, the effects are long-term, and they include, let me just give you a few facts. I'll just read them, it might be easier. Homelessness has particular adverse effects on children and youth, including hunger, poor physical and mental health, and missed educational opportunities. Schooling for homeless children is often interrupted and delayed, with homeless children twice as likely to have a learning disability, repeat a grade, or be suspended from school. Those translate into real costs for our education system. Homeless children are twice as likely to experience hunger as their non-homeless peers. Hunger has negative effects on physical, social, emotional, and cognitive development. Children experiencing homeless also encounter more violence, and violence has effects on anxiety, depression, withdrawal that have to be treated in our medical system. Homelessness is also linked to poor physical health, including exposure to environmental toxins and chronic illness such as asthma, ear infections, and low birth weight. So those are all costs that are incurred by our homeless families with children. And so in addition to the costs that are here, I think there's even more costs that are incurred by our community. So what are we doing about homelessness for families? We've had several opportunities over the last 2 years to improve services for families that are homeless, and mostly through our CalWorks program. I did have a handout at the table when you came in, looks like this, that summarizes the programs that the Regional Services Branch of Health and Human Services has available for homeless families. And the new programs that have been implemented in the last 2 years have been based on rapid rehousing models. And rapid rehousing has a couple of components, a couple of standard components. And we are not the only agency in town that's doing rapid rehousing. Veterans Resource Center is also using rapid rehousing components. And I think Northern Valley Catholic Social Services program that's working with the Community Corrections Partnership is also using some of the rapid rehousing components. And rapid rehousing seeks to move individuals experiencing homelessness into permanent housing using temporary supports and doing it in a very quick manner. Within 30 days is the goal. We don't always achieve that, but that is the goal. And those components include identifying landlords and property that are willing to work with our clients, providing case management to families, and then providing rental subsidy. So those three main components are what make up rapid rehousing. And rapid rehousing has been proven to be much more cost-effective than using emergency shelter and transitional housing. Rapid rehousing has been around since about 2009, 2008, 2009, so there is some data now to support that its effectiveness. And in addition, families are less likely to return to homelessness if they've been through a rapid rehousing program. So rapid rehousing is the model that we're using for our new programs. The programs in CalWorks we call, that we've implemented, the Family Stabilization Program and our Housing Support Program are the two newest programs. Family Stabilization was implemented June of 2014, and our Housing Support Program was implemented November of 2015. And since implementation of those programs, we have homed 140 families through the use of those two particular programs. The description of those programs are here, so I won't go through the details of that. But I did want to say a little bit about case management and the importance of case management. Rapid rehousing is based on, dare I say it, housing first, a housing first model. And housing first means that we take care of the housing needs first before we worry about the social issues. So someone doesn't necessarily have to be clean and sober when they come into the program. They don't necessarily have to have a job. That will come later after the housing is secured. That's what the case management component of the program is about. So housing first doesn't mean housing only. It's just that you get the roof over the head of the person first, and then you worry about the social issues. So case management is about helping people learn to be responsible renters, helping them manage their finances, get their credit back on track, helping them to seek employment, and get their social conditions back on track. So I do have a video to show you that kind of highlights what we do with our case management, and we'll see if it works. So, do you want to cue up the video? Cross your fingers.
All of this will be available on the United Way website, so we'll have this link as well as Melissa's information. So everything, United Way is the fiscal agent for this project, and so all of our resources we've created are all available online at the United Way. So, and I'm going to take a minute. Oh, you got to go on? Good.
So I don't think we're going to see the video. So this video was put together as an outreach tool to work with landlords in our community. Many landlords are hesitant to work with our high-risk clients that have bad credit, have eviction history, don't have good references. And so we've had a landlord engagement meeting, and we talked with them about the case management component, and that's what this video was created. And so there are 3 clients on there talking about their experience with case management. So we can upload that on the United Way website, and people can watch that when they have time.
Thank you, Melissa. I want to go back real quick to a couple of points that Melissa brought up. And you know, we had, Lloyd Pendleton came and spoke in February, and we had 500 people, 500 of our community members come in here and speak. And he had, his idea was to share with us about Housing First. What is that model? In Utah, they were able to house 91% of their chronic homeless using Housing First. And Lloyd challenged our mayor, Missy, right here, to say, well, why doesn't the city take on 5 homeless and use the Housing First model? And we didn't get support of enough council members at that time. But I just want to caution that because we name it something, and it seemed to have had a negative landing, a negative perception in our community, there are many positive attributes that Housing First represents. And because we shouldn't be tied so much to a name of something, we should look at what the components are. What are the important solutions and the services that are included in Housing First? Let's not think of the name. Because if you saw, Melissa is talking about Housing First, and when she's using case management, using rapid rehousing, and it happens to sound and look like Housing First, that's not a bad thing. Because it's working in our community, and their program is housing 140 families. So please, this is some of this, and I also want to catch up a little bit. The data will be, it's 11 pages of data. It's a lot of data, but what we wanted to highlight today is what does the data mean in our community? We can sit here and I don't want to read to you what the numbers are, and we tried to highlight what some of the important things are, and as we move through this, we'll talk a little bit about some of the important numbers. But what we want to do is the context of the data is how many of our people are homeless, what are their conditions, and what are some of the solutions as Donnell talked about and Melissa talked about. And so we're going to try and wrap our minds around who are homeless, because we need to figure out what the solutions are to match the needs that they have, and what are best practices, what are the resources out there that we need to match to those needs, and we'll try to help our community. Our next steps, which I'll talk about at the end, are how do we match our needs, identify the programs, and look for the funding resources and have the tools ready to be implemented in our community so that we make a difference for the most vulnerable people in our community. So I know Melissa shied away by saying, oh, it's Housing First. Okay, that's not a bad thing. It could be a good thing in our community, and we're gonna try and look at what are the needs of our community and match those needs to the programs that have the best outcomes. And whatever they're called, can be called Housing First. So just, I don't want us to get stuck on some titles and things, and I appreciate Melissa for sharing information about her program. Case management is also, as I look at our panel, I want to make sure case management is a huge, important component of housing and housing programs. Unfortunately, we didn't get to see the video, but there are so many people in here that are case managers, and I want to get Donna didn't probably talk about it, didn't get enough credit for expanding the number of case managers that we have in our community. That's the vital connection that we need for the homeless to stay connected to their services, so that they stay and remain housed once they get housed. And they do amazing work. So what we're talking about too is that we have all of these, and Donna mentioned a little bit, all of these able community partners working very hard at all these different projects. What we want you to come away from after this is we need to coordinate better, collaborate better, and have plans. So that's what some of this, I want to share that with you, and then you'll hear a little bit from each person about their part of the community process here. So next we'll have Matt from Good News Rescue Mission. He's going to talk with us about some of their newest programs that they're working on. And if you have, they're doing amazing work, and we all know that, the Good News Rescue Mission. I was sitting in a meeting with Robert Cronick was here as the chair of the board, and I'll never forget when he said, "Can we imagine what it would be like if we didn't have Good News Rescue Mission?" I think that they have done amazing work, and we all have a lot, we're all working hard to do better and more important, and reach out to more people. But I just want to give a shout out to Good News Rescue Mission and thank Matt. Jonathan's out of town, and he volunteered Matt, and you.
He went, oh,
So Matt's a little bit shy, but we know he knows the program, and he's a vital component of Good News Rescue Mission. So Matt.
Hi, everybody. Yes, my name is Matt Reeves. I'm the Director of Operations at the Good News Rescue Mission. I just want to kind of go over, well, first of all, I'd like to thank Kristen for inviting us here, and all those organizations and people that support us and help us every day. And we just can't get it done without you, so thank you. I'll just touch briefly on some of the things that we do, and then maybe a little more in depth on our latest projects. We have an academic center. I'm gonna be bringing up things that we feel that really help break the cycle of poverty, that help keep people off the streets and keep them housed. So our academic center, we helped 58 people get into college last year. The job readiness, which helps interview skills, computer literacy, and dress for success. 68 people were employed last year through that program. We of course have the 18-month drug and alcohol program. Our latest development on that is the opening of our, what we call the Victory House. That is the drug and alcohol program for the women. So they used to share what was called the House of Hope, and that has split up now, and we're currently under renovation with the House of Hope. That'll be the women's shelter part of the mission, and should be able to house, I believe, 81 people, 81 women residents. So the Victory House, the drug and alcohol program for the Victory House, called the Victory House, will house 24 women and up to 12 children. So that's been a really great thing. Let's see. Of course, we do emergency food. We are facilitating the Journey Home project. We were able to, I believe it's 130 people, send back to family, friends, out of town, basically. Let's see. And then another one that we have been doing quite, it's just growing every day, is the Guest Giving Back program. That's actually on our website. You can go, and if it's a business property or even a private residential, if there's a large amount of trash or any kind of mess or anything at all, we're not picky. We'll jump in and clean up whatever we can. And it's not just limited to that. We helped at things like the air show and a little bit with the games, the Colt 45 games. So yeah, like I said, we're not picky on what we'll jump in and help with. A distribution center, I wanted to bring that up. Of course, you know, that's something where someone's able to get clothing, bedding, household items, but kind of more importantly is we actually will help with furniture. So people that are getting housing, we can find beds, dressers, that kind of thing for them, and even deliver it to them. So that's been a lot of help. We're also looking at expanding, trying to get some medical or respite beds. I think I'll leave that to the doctor to speak with, but try to get more respite beds. Let's see. Oh, okay, so spoke with Jonathan. Last year, the mission helped 244 people with housing through the programs that we have developed. So I thought that was a really good number. Just finally, we just want to be able to continue helping and increase those numbers, those successful numbers that we have. We want to also create a campus where the services provided or other service providers can co-locate with us, and we can be a centralized campus to work together.
Thank you, Matt. So before I introduce Chief Paletti, I just want to say that one of the kind of bring to bear here that when we talk about continuum of care, and we often hear that term, what that means is it's literally the continuum of care. There are different solutions for different populations of homeless. So there's the Good News Rescue Mission is an emergency shelter. Then we have permanent supportive housing, which could be by NBCSS, and we have rapid rehousing. So we need to evaluate and have available in our community the continuum of care. And so I just wanted to talk about that. That's why we have as many people as there are working on this, as we need many different solutions. I want to get ready to introduce Chief Paletti, but he doesn't know that I'm going to do this. But we did the point in time, and I want to give a shout out to Ellen Pfeiffer, who spent, I think, 6 months of her time organizing and really giving our best effort to date that I can even imagine, so that we would meet the HUD requirements of counting people for a 24-hour period. And then as a result of that, it was, we have the data and all the worksheets, and Brandon Thornock from Shasta County Health Center helped us set up the Excel spreadsheets to keep track of them, and then Housing Tools was hired to enter the data into HUD, and then they created a report, which is online to United Way. That's just kind of a long way of saying that, but it's one, you know, as I said, one part of the picture of homelessness. But one of the things that Ellen helped do when we were working on the committee was we try to evaluate, we have a required number of questions and types of questions we need to ask to comply with HUD. But we also knew that our community was very interested in knowing where are these people coming from. We think that the better services we offer, the more homeless people are going to come to our community. Well, if you listen to Lloyd Pendleton, he said that people travel and move from one area to the other, homeless or with jobs. People move for the same reason. They move because of relationships, of jobs, economic reasons, the same. Homeless move for the same reason as people with jobs. So we wanted to ask the question. So I want to point out on page 2 in the handout here is when we asked the question, and these were self-identified, self-responding, or obviously responding to the survey. I spent 3 hours on Lake Boulevard doing the survey. I know Missy was out on the river, right, over here by Cypress Bridge. And I know we had 40 people at Good News Rescue Mission, I want to say, that night. 100 people, I think, volunteered in total. So of that, our questions that weren't required by HUD, but we asked them anyway. And we found out that 85% had 1 or more years residency in Reading, Shasta County. 69% 5 or more years, and 58% had 10 or more years of residency, which I think is very, we got the data. I know it's not scientific, but I can tell you when I've gone out and done outreach, when I met Thomas Matthews who does volunteer work at the Good News Rescue Mission, and he came and he was one of the people that Lloyd Pendleton pointed to as an example, and he was nervous, and we were sitting in the front of the room, and I was asking him where he was from. Oh, he's from Reading. What high school did you go to? Well, he listed 3 high schools in the different order, like he listed 9th grade last. So what grade did you, he went to Nova. I said, what year did you graduate from high school? 74. So we went to high school together. So the faces of homeless is in these data. This data shows that they were born and raised in Reading. A large percentage of them have been here for a really long time. So even if they had moved here recently, we still need to do the right thing for people who are homeless and at risk of being homeless. So I just wanted, I know Chief did a study earlier, a couple summers ago, and might have had different results. It all depends on sometimes how you ask the question and things. So I'm setting him up a little bit because I know he had been given that kind of the percent, you were kind of on top of that issue, and I said we had a little bit different results when we did the point in time. So welcome, Chief, and he's going to share with us from his perspectives.
Well, first of all, let me address that. We did self-reported data. We put down what they told us, just like they did. The one linkage I wish we would have done when we did our survey that we didn't do is where did you come from and why did you come to Reading? And we didn't do that linkage. So, do I think somebody comes from Florida for the Good News Rescue Mission? No. Do I think they come from Lassen, Modoc, Siskiyou, Trinity, Tehama counties? Yeah. Because Reading is more than a county seat. Reading is a hub city for the North State, and we're the only place that has any services. And we're going to struggle with that. And it's frustrating for me when I actually the other day was at a meeting, and another county sheriff, and I won't tell you from where, said, we love the Good News Rescue Mission. We send people down there all the time. And I said, well, stop. Build your own services. Build your own resources. You can't send everybody north of Sacramento to Reading. We don't have enough resources to deal with all of that. So if you look at this study that's been done, law enforcement's costing this $104,000 a year. I don't buy that at all. I can tell you right now that the budget of the Reading Police Department on an annual basis is about $25 to $26 million. That's less than one police officer. That is not the expenditure of the Reading Police Department on homelessness. If it was 10% of our calls for service, and I think it's probably more like 40 to 50%, you can do the math on that and see what the true cost of homelessness is to the Reading Police Department. We spend an inordinate amount of time dealing with this homeless population because there aren't resources for us to refer them to. When we did our survey, and this is the part of the survey that nobody published or wanted to report, is almost 60% of that population self-reported that they had mental health or drug abuse or both. Now, how many people do you think that are homeless that are using drugs are actually going to tell a cop that they're addicted to dope? So I think that number is probably pretty low. From our perspective and the people that we deal with on a consistent basis in Shasta County that my officers have to deal with, mental health and drug abuse are the root causal level to a majority of those that are living unsheltered in Shasta County. We have a huge methamphetamine problem, not new in Shasta County. But over the last few years, the heroin problem is growing and growing and growing and growing. And you've got a lot of different causes for that, from prescription pain medications to ease of access due to lack of law enforcement. We're not holding drug dealers accountable for their behavior. The Proposition 47 made all drugs a misdemeanor. They don't go somewhere when they're arrested for drugs anymore. Now that's a well-intentioned thing where you say let's not criminalize addiction. However, you also took away a judge's ability to order them to rehabilitation because now they're a misdemeanor. So if you go to a day reporting center graduation, which is a very successful program that Shasta County Probation is running, it is very intensive. They go there every day. The rearrest rate of that program for their 69 graduates is only 14%, which is very, very, very successful when it comes to rehabilitation programs. All of them will tell you, I came here kicking and screaming to stay out of jail because I didn't want to stay in jail. And now look at me. I'm back with my family. I'm not homeless anymore. I'm back with my kids. I have a job. It's very successful. But we're not giving judges abilities to force their hand a little bit. And that's why I keep telling everybody that jail bed space is still critical, because there are criminal offenses being taking place in this county that aren't being addressed because we don't have the bed space. But let me clarify something. Not all homeless people commit crimes. Not all your criminals are homeless. So we as an agency are here to deal with criminal behavior. And we're going to deal with that criminal behavior because that is our core function as a police department. But we need resources to take people. Right now, almost, well, I don't have a statistic because our computer system is terrible, but we're fixing that. But a vast majority of the people that we deal with are suffering from mental illness. And we as a police department, unfortunately, get the calls for those. But we don't have a lot of resources to take them other than if they're acting badly, they go to jail. If they're not acting badly and they're 5150, they go to a hospital bed. Neither the jail nor an emergency room are suited to deal with those that are mentally ill. And when 60% of the people that we talk to admit to us that they have mental health problems, I'm thrilled that Donnell has found a way to do a mental health outpatient. We need crisis stabilization so that we can hopefully use the outpatient so they never get to crisis stabilization. I hope we create a crisis stabilization unit and the thing stays empty because we don't need it because the mental health is working. When I was a young patrolman in Stockton, we had a mental health outpatient and we had a crisis stabilization unit. When I would go to somebody that was mentally ill, because what's the first thing they do when they start acting odd? They call the police. And my guys have to go deal with them. Right now, we're not giving the officers the tools to help them. We're giving them the tools and putting them in a confrontational environment with the mentally ill. When I went to them, I said, hey, Billy, because it's the same guys you deal with every day, and you know them by their first name. You know, you're veering off into right field here a little bit. He said, buddy, why don't we go to mental health and, you know, get you back into center field. 9 times out of 10, I became a taxi. I was able to give them help. With my guys, they don't have that resource right now, and it's either jail or hospital bed. Those are the only 2 options. Most of the ones that we deal with are not 5150 because you have to be unable to care for yourself, a danger to others, or a danger to yourself. Being crazy or being not 5150 or mentally ill is not a crime. It's a welfare and institutions code that gets them help. But yet, we get called because they're not acting right. And we get called over and over and over and over again, and we're not giving our officers the resources to be able to deal with them in a helping environment. And that is a vast majority of the people that are on the street that are mentally ill, that are on the street and homeless. That is leading to it. Now, we kind of get put in a position with the homeless, I feel like Stretch Armstrong sometimes. Because on one side I have the public that's sick of it, that doesn't want to deal with them pulling on this arm, and I've got all of you in the homeless advocates pulling on this arm, and I'm the guy that's stuck in the middle trying to make everybody happy. And it doesn't work very well. We have to enforce the law, and we're going to enforce the law. So I want you to consider something in this study as well. They estimate the cost of cleanup of garbage in the community at $146,000 a year. I can tell you that that is my person, Bob Brandon, who actually has a very good reputation with the homeless because he is fair. We tag them. The law says, based on the courts, that we have to wait 72 hours. We give them 7 to 10 days so that we make sure that we don't get sued and cost your tax dollars money, and it's fair. And we clean up their property. We store their property for 90 days. Nobody ever comes to get it, but we store it anyway. We follow the law to the letter when we do these cleanups. But I want you to consider that we remove 150,000 pounds of garbage from public open space alone every year. Think about the environmental damage of your groundwater, surface water, and everything else from all of that decomposing garbage. Not to mention we don't clean up the human waste. So this is a huge problem from an environmental perspective for this community. It affects our businesses, especially downtown, that we get calls from consistently every day. We have to find a solution. We can't just keep pushing them around the community, and that's what we do. You know, I liken it to a boat going through water. When the police come, It's like the boat pushing the water aside, and when the police go away, the water fills back in. We can't just keep pushing them around. But we have to clean up the trash. And I'll tell you that $146,000 total and that garbage total that I tell you doesn't count what Shasta Support Services cleans up on private property. We had one cleanup last year where they removed 162,000 pounds of garbage from 126 acres. One property. So we have to find some solutions to be able to fix it from an environmental perspective. People that are homeless, that are desperate, do steal, and we catch them on a consistent basis. We need to be able to intervene in that. And we need to be able to intervene in it because why are they stealing? They're stealing to feed their drug habit. Opium, methamphetamine are the cause of probably, I would say, 80% of the property theft that takes place in the city of Reading. It's there to feed their drug addiction. And we have to find solutions to that. I've been a huge advocate, and Missy has got behind this, and we need a sobering center. Because right now when we arrest somebody, and last year we arrested almost 1,000 times, not people, but 1,000 arrests for public intoxication alone without a 148 or without a resisting arrest, which means their intoxication is their only crime. A sobering center, right now they go to jail. They get sober, they walk out the back door of jail, what do you think they do from there? Go back to their addiction. A sobering center, I want you guys to think of it this way. A sobering center is a portal to rehabilitation. That's what it does. And I've been working and talking with Donnell quite a bit about the importance of having a linkage between the exit from a sobering center and the rehabilitation program that's waiting. And what's the funding mechanism going to be for that? Because all of our funding mechanisms for rehabilitation come through probation, which means they got to go to court. Well, if we're going to divert them from the criminal justice system, where's the funding mechanism to get them, if that person hits that exit at sobering center and says, yes, I want to go to Empire Recovery Center, I want to go now, I need to get healthy. It's not going to work if we say, okay, come back in 5 days and we'll have your Medi-Cal drug set up for you. There's got to be more immediacy than that so they can get in a bus that's sitting outside or a van driven right to that drug rehabilitation program and get them there today. We have to start looking at this stuff from root causal levels. And we can talk economics or anything else, jobs, whatever, but from our perspective and the ones that we deal with on a consistent basis, the biggest problem is mental health and drug addiction, and that's why they're there.
Thank you, Chief. Next, we're going to have a presentation from Dr. Tyson Adams. I just want to bring your attention back to, if you look on page 1, and we put those the numbers in bold so we wouldn't miss them, and that is that there are 3,000, over 3,000 homeless in our county, and then the dollar amount is it's $34 million. But this is not, as I think I said already, it's not scientific that we gathered that data. That's because no one in this community collects data exactly the way that we would need it to have a very scientific approach to it. So we did the best we could. As Chief said, that the number for law enforcement is low, but we took our best guess, and all of these numbers are our best guess. But it's also using national standards in a way on how communities have been addressing what it costs for homeless and how do you measure that and by the number of people. So what it says is that nationally they do studies and they say, well, that 60 to 70% of those costs, the $34 million, can be attributed to the highest utilizers of those services who cycle in and out of the emergency room or jail. And in our county, we looked at 10% of the 3,000 is typically what communities find are the number of the highest utilizers. So then we divided that by the $20 million, which is the 60% of the $34 million, to come up with the number of $66,188 per highest utilizer. And so that's the number that Lloyd Pendleton was talking about, the number you say, this is what it costs for someone to cycle in and out of our most expensive health care. And then we have alternatives which cost less. So I just wanted to give a little bit of feedback because I would like to have Dr. Tyson talk more, Dr. Adams talk more, because people do that all the time, right? Talk more about, what, he's, working with it day in and day out, but I also I wanted to share a little bit about how the math worked, because how did we get to the number? It's in the fine print on the last page. But we did take national studies and look at them. This is very much in line with other communities and other studies that have been done to try and figure out what is the total cost, what is the cost for the highest utilizers, realizing that not every homeless person is going to cost a lot of money to, to impact in our community, but there's a small percentage that are having a large impact on our community cost-wise. Well, I met Dr. Adams by phone and email and found out that he has been studying homelessness and the solutions and works right here in our community in a very important field of medicine. So I want to invite him to come up and speak to us.
Thanks. So I wanted to make a couple comments that, first of all, healthcare and the police force are the two most expensive ways in which people who are homeless interact with our community. And, those percentages vary based on the studies that I've read, but healthcare is actually still the highest cost for the homeless, even though the law enforcement, I think, is like 10% behind in every study that I've read. It still is, between the two, about 80% of total cost, varying, and which is phenomenal. And now the population of the people that are the highest resource utilizers, they're called high resource utilizers, are about 10%, as Kristen alluded to. Those people we see in the emergency department, and we admit them into the hospital on a regular basis. I just randomly asked one of the ER doctors yesterday, today, I said, how many homeless people do you see on a daily basis? And he said, well, I see one for sure every day in the emergency department. And, you talk to the physician's assistants who deal with the less critical issues, and they may see more because they see more less critical patients. And, when we get these patients in, they have the same medical problems that everybody else has, right? Just as a quick aside, how many people in this room take a medication on a daily basis? Raise your hand. All right. So how many of you keep those medications somewhere? It's the same place that you put it every day. You take it at the same time every day. It's part of your daily routine. Right? Okay. So how many of you take a bath or a shower on a daily basis? Right? It's pretty much everybody. All right. Okay. So the fact that you can do those things. Two more things I want to point out. Did you sleep in a bed last night? Everybody slept in a bed. I mean, I'm assuming that if you didn't sleep in a recliner because you fell asleep in front of the TV, you slept in a bed, right? And how many of you have a door that you can lock so that people don't mess with you? Right, everybody in this room, for the most part. I did notice that there are no homeless people in the room, or it doesn't look like it. Are there any homeless? I should ask. No. Okay. So I think that's a problem also. They're kind of the disenfranchised characters, right? They're not a part of the discourse in this public arena. They don't vote. They don't show up to things like this. They're disenfranchised. At any rate, back to those four things. You're taking a medication. It's in the same place every day. You take a bath. You slept in a bed, and you had a locked door. Would you believe me if I told you that means your life expectancy is 22 years longer than the people that don't have those four things? 22 years based on a Dutch study. So this is probably the single biggest healthcare investment we can make in terms of life expectancy. There's no medication I can give to somebody that's going to make them live 22 years longer. None. On a regular, consistent basis. Now, when we talk about these people, we're talking about skin conditions, we're talking about all the same conditions that everybody else has: high blood pressure, diabetes, chronic kidney disease, whatever, glaucoma. You've got a ton of, everybody's got different medical conditions. The homeless have the same medical conditions. The problem is they can't manage those medical conditions because they're trying to feed themselves. They're just trying, or in some cases, they're trying to hide from reality through substance abuse, or dealing with their mental illness, which is completely out of control because they can't take a medication every day. They don't sleep well. I mean, I'm just giving common sense stuff, right? And I want to tell one story. I can't use names, can't use a lot of details, but I want to tell you a story that illustrates why we are spending so much money on these people, these higher resource utilizers. I met a man in the emergency department about 8 months ago, 9 months ago. He was my age. The only difference between him and I was that he had type 1 diabetes and didn't have a home. Now, when you have type 1 diabetes, you have to use insulin. You have to store the insulin somewhere. You have to be clean enough that you can inject yourself with insulin. It's a tough condition. He'd had it since he was a teenager. He had a bachelor's degree from Chico State in political science. He read the newspaper every day that he was in the hospital. After a month or so of getting this guy's conditions under control, he basically had fallen apart because he was always sick, right? Type 1 diabetes is a bad disease. You're sick more. He got to the point where he needed rehab. We could not send him to rehab because he did not have a discharge address. None of the rehab facilities would take him. He's a 40-year-old guy, homeless, forget it, no way. Liability, he's going to be stuck here forever. Because of that, Partnership and the hospital, Partnership Health Plan and the hospital, invested hundreds of thousands of dollars on this guy for him to just sit in the hospital. The number of people who we could have given a place to put their medication, a bath or a shower every day, a locked door, and a bed, for the amount of money we wasted on that guy, because we could not get him into a rehab center because he didn't have a $500 apartment. It just blew my mind. I was like, this is the biggest waste of tax money I've ever seen. The amount of money we spent on this guy could have paid for my entire college and medical school education. Believe me, it was expensive, right? So when I started looking at this, I was like, there's got to be a better way for this. What is this going on? I started talking to people, and I heard about this Housing First program in Utah. And I went to Lloyd's talk, and I thought, well, this makes a lot of sense. When I go to shop for something, for instance, I try and buy one thing that's really high quality, so I don't have to buy it over and over and over again because it breaks, right? So I think, and I'm not a big spender. I'm a little bit of a frugal guy. So I'm like, I want to spend money really well. Why give a big expensive drug when a generic drug will work just as well, right? I have no reason to spend people's money. I have no reason to spend taxpayers' money. If I can get better health outcomes, I can make somebody live 22 years longer by spending less money. That's a no-brainer. That's a no-brainer to me. Spend less money, put them in a house, give them counseling, get services around them, check on them every week, make sure that they have opportunity to get an education or job training or whatever they want. Some of these people are disabled though. Remember this. You're asking a disabled person to work. 42% nationally of the homeless are disabled. Mental disability, physical disability, regardless. 42% nationally. Now, we're only 35% based on the stuff that I was reading in these articles of the homeless in this county are disabled. So either our data is incorrect or we're actually taking care of our disabled a little better than I thought. But 42% being disabled and on the street, those are expensive people to take care of. So at any rate, what I want to kind of finish with is we need to make smart investments. And I think that's what Chief Letty was kind of getting at. He mentioned this taking someone somewhere. You can't just say, I've done my part, I'm this entity, and now I don't have any places for you to go, so get out, right? And there needs to be some place for his officers to take these people who are disabled, and ill and have infections and all these things to the hospital, and the hospital needs to be able to get them into some sort of housing somewhere so they just don't rot in that place. Now, by taking care of that very small population, this 10%, and Lloyd mentioned this in his talk, they are super high utilizers. They take up a bed at the mission, they take up a bed in the hospital, they take up a bed in the jail. If they aren't taking up those beds are available to the 80% of the homeless who are temporarily homeless. They're not chronically homeless, they're not disabled, they're temporarily homeless through situational issues. Divorce, lost a job, house got foreclosed, sick family member that died that they were living with, whatever it is, a million different reasons. The 80% that are temporarily homeless just need a bed at the mission for a few nights. They need a little bit of resources to get them back into housing. Those chronically ill are filling those beds on a month, they're month after month after month. If we could get them into housing, get them out of those beds, those temporary beds, like at the Good News Rescue Mission, are available to the people who suddenly find themselves out on the streets and need, for a short term, which is what that place was meant for initially, a little bit of help. The Good News Rescue Mission is not a home. It is a shelter. It is, by definition, not a permanent address. It is not a home, as we all have. And if we free those beds up by giving the people that are living there now and utilizing all our law enforcement and medical services, those people who only need temporary help will have that resource, and it won't be taken up by these other high utilizers. So anyways, thanks for
That was a great ramble. It's very important. We try to have a different voices here to talk about the different aspects of homelessness in our community. And Tyson is right. Medical is one of the most important. It's critical that we get this right, that we figure this out. Now I'm going to talk a little bit about what our next steps are, and then we'll open up for questions, because I'm sure we have questions of the panelists. I want to thank them very much for their time and coming here. I want to talk a little bit about what our next steps are, so that we can, you might have questions about that too after I finish this. So if you look on page 1 at the top, completion of the strategic plan, we're working on that. We should have that done by the end of this month. The important part of a strategic plan is once we gather data, we understand who our homeless are, we look at best practices. We've been working in our community since July in gathering input from community members, from community resources, service providers. And we've had a number of meetings with the consultants that we hired to do the strategic plan, and so that will be wrapping up in the end of June. Then we'll have a kind of a roadmap to say, here are the highest priorities that our community members have identified, what are best practices, and what do we need to do, and give ourselves goals and timelines to achieve the goals, and ways that we can assess that we are doing what we think is the best, and if we're not, we need to change course and figure out what the best thing is to do. So that's one of the first thing not the first thing, but it's one of the things we're working on. We're also, the next step, we want to restructure our continuum of care. We talked about how important that is to have a collaborative body in our organization in our community. And we are putting together a proposal. We have a committee of community members who put together a proposal on how we need a greater staffing of the continuum of care. We've also been working with Shasta County, and we're looking for a nonprofit to be the lead instead of the county. They would have possibly greater access to resources, including county and the cities contributing. Larry, please. So we're putting together a proposal that the cities, Shasta Lake is confirmed, City of Reading is confirmed for June 21st, and the County of Shasta Board of Supervisors is confirmed for June 28th. Then we'll hear a proposal that our committee has been putting together on what is the cost to have a continuum of care staffing, appropriate staffing, so that we really build our strengths and our collaboration and coordinate better. Also, we need a better data collection system called Homeless Management Information System. It's a requirement for federal funding, but it's also key to understanding how our homeless are benefiting from the programs. We need to have the appropriate measurements so that we know where we need to make changes or improve what we're doing. So that critical piece of collecting data, so we're not doing studies that we can debate whether we got the right information. Well, I guess we can always debate about information depending on which way you ask the question, but Homeless Management Information System is a critical component for our next phase. And also, one of the important things that is a best practice is a coordinated assessment, a coordinated entry system, and that's where anybody coming into the community, I mentioned earlier, would go to an agency and we'll all be using the same intake document, ask the same questions, make a quicker evaluation of the person's needs so that they get referred to services more efficiently. It's going to save money to the service providers because they're not each doing it every time someone comes. Can you imagine? It's like going to the hospital and having to fill out the form every time, even though you've been there before with the same condition. So this is also a best practice across the nation, and it's a HUD requirement. So that's going to be, we're designing what that project could look like, and then presenting that to, like I said, the 3 cities. I'm meeting with Anderson tomorrow to see if we can put it on their agenda. So we're also reaching out to our community to find financial support for this. This is such a huge and critical piece for us moving forward, to have that support for the continuum of care, to improve how we collaborate and coordinate. And we'll also be subcommittees. There'll be all of this will be posted on our website, the United Way, and you'll see there's a list of, once we get the continuum of care up and running, we'll have subcommittees. The community members, they're already welcome to come to the continuum of care meetings, but we'll have subcommittees that will really take charge and look at the the smaller, not smaller, but for example, on just assessment and doing the HMIS, we need a subcommittee. We need a subcommittee for addressing prevention and how do we get more housing how do we deal with housing case managers and work with more landlords. So there's a lot of ways that the community can be involved. We haven't talked about the Community Care Fund, which is started with Donnell and community members at Bethel to support a funding program that would help homeless, primarily the ones who aren't eligible for other government assistance, help them with the barriers and obstacles they have to getting into rental, like they might need the first and last month, or they might need to pay back utility bill. Amazingly, as things as small as needing cleaning supplies, that how when we want to drive at the end in December for coats and socks, it turns out one of the main needs that the homeless have are just having cleaning supplies, laundry detergent. Those are the kinds of things that we're all going to, as we work better together and we coordinate better, we're going to learn about more of those kinds of ways that we can all pull together. So that's some of the next things that are happening. I haven't done this yet sufficiently. I want to thank the donors. We have over 53 donors for our project that we call the Reading Area Homeless Coalition Project. We started with 1 phase, moved into phase 2, which is the strategic plan, and to date we've raised over $92,000 from our community. That's the commitment that I think our community wants to participate in and have generously supported this project so that we can be here today talking to you. They've funded the strategic plan, phase 3 and 4, which is the continuum of care, restructuring the homeless management information system. We're primarily looking right now at some government funding, but we're also going to come in with more community support through nonprofits and businesses. I've already reached out to more businesses to ask them to help support that important piece for us so we can implement the strategic plan. We can implement a better coordinate continuum of care. So I've talked enough. I want to have, if you have questions, please stand up, and we don't have a second mic, so we'll have to talk loud, and then we'll answer your questions. Questions? Wow. That was, we don't need questions. Did you guys have any more answers you want to share without the question?
We had city council last night.
We have a question in the back.
Well, okay, Dean.
More a point. I think that Dean Germano from Shasta Community Health Center, in the studies in the communities that really have taken hold of this issue, the one point they wanted to make with communities, and I think is really important, is that the community can make it. Homelessness is not hopelessness, right? I think the key is that there are interventions that can make a huge difference. You're never going to get to perfection. I don't think we'll ever see the end of homelessness per se, but we got 3/4 of the way there. Isn't that good? You know, if we can make these changes, can we free up resources for the police department to do other things? If we can free up resources at the hospital to do other things, if we can get more into prevention, if we can, I just wanted to say that this can be done. That's the point. Communities have done this work, and it's challenging us to do it. We can do it.
Thank you, Dean. Well, it's true. You know, when I first started and people were saying, well, how many homeless do we have? I had not a clue, really. I honestly didn't. And when I was doing research with I was in Santa Clara County last fall, and I was talking to a lot of people, and they have 6,000 homeless people in their chronic users. And when I was talking to one of the women who'd been working in a nonprofit to help with homeless, and she said, well, ask me again, how many homeless do we have? I said, well, I think I relied on Mike Thomas, who's our code enforcement officer, and I kept asking him, how many homeless do we have? And he said, you know, without this study, I already knew. 300, we have 300 chronic homeless. So when I shared that number with Jennifer in Santa Clara, she said, 300? You only have 300? So, I mean, she said the same thing. That's what reminded me that Dean is saying, okay, this is a solvable problem. I know we have the skills, the abilities, we have wonderful, great service providers that are already doing great work. So the message, the takeaway tonight is we need to come together, we need to collaborate and coordinate our efforts, and there are already best practices out there. We're not reinventing any wheels here. We're just putting our minds together and getting the appropriate resources to finish the planning, to start the implementation of our plan, and we'll be available online with information. You'll have information you can download, and also if you want any more, leave your name at the front if you haven't already, if you're not on our email list for more information later, where you can volunteer. Well, thank you for your time.